Hello, everyone. Welcome to the Falling Walls Breakthrough Conversations. With this format, which is realized in partnership with the Federal Ministry of Education and Research and Springer in Nature, we aim to create an intimate space for you to get to know global science leaders, entrepreneurs, and the idea here is to get to know the speakers, their career path, and their experiences. So, my name is Filipe Almeida. I'm an associate editor at Nature Biomedical Engineering. And before we start, I want to invite everyone that is online, our audience, that they can make and pose some questions to the speakers. And this way, we aim to engage in a conversation and to talk about the subjects that you want to talk about. So it is my pleasure to introduce Jane Achan. So Jane is a principal advisor at the Malaria Research Coordinator, and before she was at the Medical Research Council unit in Gambia. Jane has been involved in clinical and operational research in fields of infectious disease, maternal and child health, and health systems for the past 20 years. So welcome, Jane.
Thank you so much.
It's great to have you here with us.
Thank you.
So I want to talk first about your area of expertise. And so you mentioned that you want to see malaria eliminated in the sub-Saharan Africa. Just to underline again the serious problem that malaria still is, in 2020, there was an estimated 627,000 malaria deaths worldwide. And in sub-Saharan Africa, this accounts for 93% of these total deaths. So do you want to talk about your personal take on the matter, and what does this mean to you personally, and also what is needed to achieve the goal that you're setting?
Thank you, Felipe. Indeed, malaria remains a main problem, especially in Africa. Like you mentioned, on the wards where we work, I'm a pediatrician by training. 60% of the children we see as clinicians are admitted because of malaria. So it causes a lot of sickness and death in many settings in Africa, and this remains a huge public health problem. I currently work for an organization called Malaria Consortium, and what we do is we implement a lot of programs that are targeted at controlling malaria, but also other infectious diseases. So through this organization, we implement evidence-based interventions and control methods. And we think that through consistent implementation of these interventions, we should be able to control malaria. And I'm really passionate about malaria because it's a preventable disease. Simple, low-cost interventions implemented consistently and ensuring that we provide adequate coverage for the population that needs these interventions significantly contributes to a reduction in morbidity and mortality, or in illness and death. So my passion is that we have a disease that is entirely preventable and yet continues to cause a lot of sickness and death. And we think that if we utilize the available tools very well, we can achieve a significant decline in the malaria burden. We also need to embrace new tools that are currently being produced. We know, for example, there's a malaria vaccine that is yet to be rolled out. So we are working with different partners to support the African countries to be able to embrace these new tools and implement them in a timely way. And through these consistent strategies and collaborations with governments, with partners, we think that we can achieve a significant reduction in malaria burden, but also achieve malaria elimination. So that's something that I'm passionate about because it's feasible. We just need to do the right things to achieve that. Yeah.
Absolutely. And so you are part of the Falling Walls female science talents.
Yes.
So the goal of the female science talents program is to inspire and empower talented women in science. So can you explain your views of what this program entails and why do you think there's a need to empower women in science?
So I've been very privileged over the past 1 year to be one of I think the first group of female scientists on the intensive track program. So it's been a year of structured mentorship, networking, and capacity building for really soft skills that most of our training does not provide. So we've had a lot of interactions with role models. We have exchanged a lot of experiences, so sharing challenges, sharing learning. So I think the last 12 months have been a period of significant growth for me as a female scientist. And I think this is something that should be replicated across different settings. To be able to have a role model in the field that looks like you and has traveled on this path that you want to travel and has actually succeeded, not without obstacles, but has succeeded in a way that you can overcome those obstacles. So I think this is really a great program. And I think this program should be replicated in other settings as well. And I really would like to thank the Falling Walls Foundation for this opportunity. I think we've been a group of 20 female scientists from different fields. So it's not just medicine, it's really different fields, agriculture, engineering, astrophysics. So it's been a rich experience. And I believe that this is something that needs to be propagated across different settings, especially since it addresses an area of need that individually we may not have had the opportunity to experience within our training institutions and within our mainstream career paths. So really commendable program. Yeah.
That's really nice to hear. And so you touched on my next question, which is mentorship, right? The importance of mentorship. Yeah. So if you want to elaborate a little bit on that, but not only, what are the main ingredients that make good research?
So I think there are a number of different ingredients that make good research. And one of the basic requirements is having an environment that is conducive for research. And the environment may be an institution, but it also may be the resources available in the different institutions we have. And in that environment, mentorship is quite key. And the reason mentorship is key is that it provides a guidance. You basically have a mentor who holds your hand and directs you into a path that is easier for you to achieve your goals. And I think that also for research, you need to be able to have a good understanding of what the important public health issues are. You need to be able to ask the relevant questions for the relevant settings, and you also need to have the necessary skills to be able to undertake good quality research. And that may either be through training or infrastructure development, but also through capacity building. And another aspect that I have found key in being able to conduct research successfully is collaborations and partnerships, because you may not be an expert at all aspects, but working together within the context of collaborations and partnerships really broadens your scope and supports you in areas that you may be inefficient at. So a number of things really that come together to make good quality research. Yeah.
Interesting. And now I want to talk a little bit more the context of what has just happened in society and the world, namely the COVID-19 pandemic that is not eradicated, but there is definitely a lot of lessons that we're still dealing with that really severely impacted our society. So I want to hear your take on these aspects. What has COVID-19 brought to the world, science, and society?
So I think COVID really has presented in two aspects, I would say. So it's caused significant challenges, but it's also brought up significant opportunities for scientists. I think many of the challenges have really been related to a significant change in our ways of working, but also significant loss of lives. Sometimes for colleagues, especially for healthcare workers, we lost a couple of colleagues in the response to COVID-19. But I tend to view COVID-19 mainly from the positive aspects. I think even with the changes in our working arrangements, I think there have been significant opportunities. We've been able to network in geographically broader scope than we have been able to do before, because a lot of the things are happening online or digitally. So the new ways of work have also brought up new opportunities for us as scientists. I think at the individual level, for me as a scientist, COVID-19 has also opened up a new research space. We have been able to broaden the kind of work we do and also actively now do research on COVID-19. I've been able to extend my scope of work from malaria, and actually I'm currently now looking at interactions between malaria and COVID-19 and contributing to new knowledge. Especially in the settings where we work, these new diseases come on top of other existing diseases. So we have a challenge of COVID-19 in Africa, but we also have the other infectious diseases that are actually more prevalent and endemic. So things like malaria, HIV, TB, and it has been an opportunity to understand how does COVID-19 change the epidemiology of these other diseases that are already prevalent in Africa. So significant challenges that were brought up by COVID-19, but also really, really significant and important opportunities. And just, for example, understanding the pathways for research, we see the pathway for the development of the COVID-19 vaccine, which was really rapid. And I think that has also provided an opportunity for other vaccine development to see how best this kind of pathway could be followed. If I compare that, for example, to the malaria vaccine, it's taken over 35 years, and we still have just gotten a vaccine for malaria approved by the WHO, and it was about 12 months for COVID-19. So important lessons learned in the response to COVID-19 that can be extrapolated to other diseases and other epidemics in future, but also important lessons in product development that has occurred in the context of COVID-19 that can also be extrapolated to product development for other diseases. Yeah.
Interesting. So I don't know much about the subject. So do you want to elaborate a little bit on that, what you were just saying about the COVID helped to understand other infectious diseases and how they spread, and so I'm more curious to know a little bit more. So what are the exciting findings
I
that come
guess
from that research?
maybe will explain a bit about the research that I did, and this was done in Uganda, where I currently live and work. We were essentially interested in understanding what are the interactions between COVID-19 and malaria. And we had the opportunity to answer this research question in the context of the acute epidemic in Uganda. And we essentially looked at patients who had come in with COVID-19 and did two things. So we assessed them for concurrent presence of malaria infection, but also looked back in time and measured immunologically how much malaria they had been exposed to in the past. So what we found was actually quite interesting, that we think may explain the epidemiology of COVID-19 in Africa. We found that African patients who had had a high previous exposure to malaria tended to have less severe forms of COVID-19. So they were either asymptomatic or had mild COVID-19, and overwhelmingly they did not die. But the African patients who had low previous exposure to malaria presented with more severe COVID-19 and tended to have a higher mortality, essentially behaving like the patients in Europe who had not had malaria before. So we think that this could potentially be an explanation as to why the COVID-19 pandemic was not as severe in Africa as was predicted. But this is an area that we are evaluating further, also trying to understand what happens to these individuals after they've recovered from COVID-19. Do they change in a way that they are at a more severe risk of the common infectious diseases than before? So really a huge opportunity for additional research questions in a really new area that we are working on. Yeah,
very interesting.
Yeah.
So I think we have a question from the public. Whilst we were working on bringing this question, so we're talking about public health. So what do you think the future of public health is? I know it's a very broad question, but please feel free to talk about the areas of your expertise, even geographically speaking.
I think public health is a key component of our daily living. And I think public health has changed significantly over the years. There are a number of things that are happening that are increasingly changing the challenges that we face as public health practitioners. So we have a lot of things that are ongoing, like climate change, that essentially changes the profile of health challenges that communities have. But we also have new and emerging infectious diseases that we need to increasingly be able to be equipped to respond to. So I think in terms of what the future of public health is, I think the public health domain needs to evolve, needs to be more responsive to new challenges, but also needs to embrace new innovations, because as challenges emerge, we need to have more innovative approaches to responding to these challenges. So I see a lot of innovation and growth and a lot of responses and a lot of evolution that we need to do, or we need to go through as public health practitioners to be better equipped to respond to emerging challenges that will occur, whether through physical, environmental, or also due to other diseases that will be coming up.
Yeah, absolutely. So I think we have the question now. Yes. Hi. Yes, we can hear you. To prevent the next pandemic, big pandemic.
Okay, very interesting question. And I think what we need to have in place is strengthened surveillance systems. And why do I think surveillance is key? I think through very strong and efficient surveillance systems, we are able to recognize or pick up any emerging infections early. And in the early detection of cases, we are able to then efficiently institute the response loop. So what aspects of surveillance do we think needs to be in place? I think we need to have routine surveillance systems at the point at which these individuals present. So within the health facilities, at that lowest level of care in that African country, we need to have a surveillance system that will readily recognize a strange presentation, increasing numbers of cases with a unique presentation, and also coupled with more innovative approaches to surveillance. For example, genomic surveillance to be able to detect the organism as early as possible. We saw that when the COVID-19 pandemic happened, there was a significant lag in identification of the new bug. But then, because of the area where it emerged, there was genomic surveillance that quickly identified the new infection. So really having strong surveillance systems that can pick up the new signals, but also ensuring that there's an effective response mechanism. So it's not just surveillance, there needs to be in place effective response mechanisms that will be able to ably address this emerging pandemic.
Yeah, certainly a very fascinating and complex topic. Yes. And so we're running out of time. Okay. And very briefly, my last question to you is, what would you be if not a researcher?
Well, interesting. I have always wanted to work in a bank. I was always fascinated by the ladies behind the counters and generally the professionalism within the context of the bank. But I've ended up in medicine and research, and I really do not have any regrets about that.
Well, lost for the banking system, and we're very happy to have you here in science with us.
Thank you so much for having me.
Yeah, it was a pleasure to talk to you. I wish we had more time, but I am afraid we have to leave it there. So thank you, everyone, for this amazing session.
Thank you.
And thank you. Thank you, Jane.